Hey there, it's Dr. Jim. Thanks for stopping by for a very important CBD related topic. And it comes out of my book, Living Longer and Stronger with CBD. And it's in the chapter on mental and emotional health. My topic today is addiction and CBD. Substance abuse, substance use, addiction, whatever we want to call it. These are very serious problems in the United States and are responsible for significant physical and mental health problems, loss of income, marital and relationship difficulties, and premature death. For those individuals struggling with an addiction problem, as well as an emotional or a mental condition, their clinical picture becomes more complicated and treatment and recovery become more challenging. Now, there are lots of medications, prescribed medications, psychiatric drugs, therapies, and programs out there currently being used. But many experts agree that a natural alternative treatment is badly needed. And this is where I became very encouraged and excited about CBD's use in addiction. Let me provide a brief review of addiction, and I'm going to rely on the book that I always go back to, the DSM-5. According to the DSM-5, published by the American Psychiatric Association, substance-related disorders fall into 10 different categories based on the drug or substance that's being used. They are alcohol, caffeine, cannabis, hallucinogens, things like LSD, PCP, inhalants, things that people sniff, glue, gasoline, nitrous oxide. Of course, opioids, which are presenting a horrific, difficult problem among so many people in the United States and around the world, including OxyContin, Vicodin, fentanyl, and heroin. And then we have sedatives, hypnotics, and anxiolytics in one category, stimulants, which are amphetamine-based drugs, tobacco, and then everything else, known or unknown, that people use or abuse. So, according to the DSM-5, quote, all drugs that are taken in excess have in common direct activation of the brain reward system, which is involved in the reinforcement of behaviors and the production of memories, end of quote. That's an important idea. Now, according to this view, addiction can be described as a brain disorder characterized by compulsive engagement in rewarding stimuli and regardless of any negative consequence or outcome. It is also thought of as a chronic disease typified by motivation, rewarding the brain, and memory. Those three things are important: motivation, brain rewarding, and memory. The user finds relief or reward and then remembers the feeling by using a substance. Addiction is also known as a relapsing disease or disorder. Now, there are two important neurotransmitters, brain chemicals, that are involved in addiction: dopamine and glutamate. Now, since addiction is described as a disease of the brain, researchers have studied the roles that dopamine and glutamate play in addiction. Dopamine is the brain chemical that makes us happy. Many forms of addiction occur due to the brain's reward system flooding the circuit with dopamine. Drugs increase dopamine output, which causes us to feel high, euphoric, happy. Dopamine also plays an important role in two areas of the brain: the hippocampus and the amygdala. The hippocampus, which is responsible for the formation of memories, imprints the rush of good feelings that are produced by drugs or substances. The amygdala which regulates emotional responses, develops a conditioned response to the substance being used. Now, on the other hand, moving away from dopamine, let's look at glutamate. Glutamate more recently has received attention as the neurotransmitter that may play a greater role in the development and maintenance of addiction. Glutamate is involved in the reinforcement and habit development of addiction. It has a strong effect on cravings, relapse, and drug-related memory. Opioid addiction in particular, has been associated with the powerful influence of glutamate. And in this sense, addiction can also be described as a disorder of both learning and memory. Those are key. And it has been discovered that these important neurotransmitters, CBD, and the endocannabinoid system all work together in beneficial ways. Dopamine, glutamate, CBD working synergistically in a number of ways. Now, what I'd like to do is give you some bullet points of research findings, and that's what I talk about in my book, Living Longer and Stronger with CBD. While research examining the medical uses of CBD for addiction is truly in its early stages, its infancy stages, if we want to be brutally honest, many results do seem to be promising. And that's what got me fired up about doing this research and writing a whole book. Besides the use of CBD, researchers also believe that targeting the endocannabinoid system itself may become an effective way to treat people addicted to a number of substances. But opioids in particular, there appear to be an important relationship between pain, opioids, and the circuitry within the endocannabinoid system. Here are some important takeaways from my presentation to you now, and these have evolved over the past 20 years. Researchers from Mount Sinai of Medicine in the United States found that CBD had an effective impact on heroin self-administration and drug-seeking behavior. They believe that CBD can become a potential treatment option for people experiencing heroin craving and risk for relapse. Those are pretty important. A connection between the endocannabinoid system and cocaine use, another study, another finding, was discovered by two researchers. They believe that there is a dysregulation of one of the CB receptors in the endocannabinoid system. It's called CB1. The dysregulation of the CB1 receptor induced by cocaine causing brain alterations and neurotoxicity in the brains of people who are addicted to cocaine. There's a dysregulation occurring. CBD may be a viable treatment to help people wean off of cannabis, heavy cannabis marijuana smokers, as well as to treat cannabis withdrawal syndrome. Another finding, researchers explain that CBD works by interfering with reward mechanisms in the brain that are responsible for the expression of the acute reinforcing property of opioids. Another finding, CBD may have therapeutic properties on psychostimulant, cannabis, and even tobacco addiction. Another, CBD has been found to be a good treatment for various symptoms which are associated with addiction, like anxiety, depression, insomnia, and pain. So CBD is actually treating multiple associated symptoms. Another finding, a research report appearing in the journal Neuropsychopharmacology concluded that CBD affected stress-induced drug-seeking behavior in experimental animals, rodents, without tolerance, sedation, or interference of normal behavior. CBD also reduced experimental anxiety among the rodents and prevented impulsivity in rats with a history of alcohol dependence. My last bullet point. Another study at Mount Sinai in New York found that CBD reduces both cravings and feelings of anxiety that are often accompanying people who are addicted to heroin. So my final thoughts, and thank you for hanging in there with me, I appreciate it. There are only a few studies examining the effects of CBD in addiction, but I know there are going to be a lot more, and I'm reading as much as I possibly can all the time. Obviously, for CBD to become a real, viable treatment for any addictive behavior or disorder, we need a lot more research. Having a successful, non-opioid based medication would be a great addition to the existing treatments for addiction. CBD may not only become an effective treatment, but perhaps it could help to reduce the enormous healthcare costs and loss of life in the United States and around the world. Addiction and CBD. I hope more research shows that it can become a successful treatment. I'm Dr. Jim. Thank you for stopping by. Keep coming back for more information on CBD. Thank you. Thank you for watching the video, and I'd like to show you my new book, Living Longer and Stronger with CBD. It took me about a year and a half to write as I scanned hundreds of articles in prestigious journals, peer-reviewed medical studies, examining the effects of CBD for various physical conditions, emotional and mental issues, and neurodegenerative conditions. And I condensed all of those findings into one book. I believe that there's something in here for everyone. So, if you're interested, follow the link to the book on Amazon. Thank you so much.